Hi, this is Dr. John Pelto. I want to go over today how to treat heel pain and specifically plantar fasciitis. This is for you if you have heel pain, if you're one of my patients, if you're searching on the internet of how to best treat heel pain or what are some of the newer types of treatments, and if you just want to learn more about this condition. So first, let's go over a little bit about what plantar fasciitis is. To keep it really simple, the plantar fascia is a ligament that runs from the heel bone all the way to the ball of the foot. That's called the plantar fascia. The plantar fascia connects into the heel the same way that the Achilles tendon connects into the heel, and there's kind of a little tug of war going on between the Achilles tendon and the plantar fascia. This area can get very, very inflamed over time. Now, we always say that the plantar fascia isn't a primary support structure, so there are many other tendons and ligaments around this area that if they are not working well, then they put increased strain on the fascia. So a bulk of our work is going to be actually looking at what plantar fasciitis is and what it is not. But let's go a little bit more into the anatomy here. So if you look at this next image, you can see that all the muscles on the bottom of the foot and also on the back of the leg kind of revolve right around the plantar fascia. So the plantar fascia would be right around here. And you can also see that that's an insertion point for the tibialis posterior, which is a muscle starting at the back of the leg going around and kind of inserting with a portion here and then a portion further up. And these muscles, if these aren't working well, if they're bound down, if they're injured, this can cause or make your plantar fasciitis worse. And a couple of the other ones are the flexor hallucis longus or the peroneals. These are all some other muscles back there. And how about the question of heel spurs? So I have a heel spur, doctor. Is the heel spur the problem? Or let me get an x-ray because I have a heel spur. To keep it simple, sometimes heel spurs can be the culprit, but usually not with strict plantar fasciitis. With a heel spur, sometimes you can develop a sac of fluid down here called a bursitis, which is a sac of fluid. Very rarely, but you can get a fracture of the spur down here. That's why we usually get x-rays. But very rarely do we remove the spur anymore. So it's usually not the heel spur. So let's go on, and before we talk about how to treat plantar fasciitis, I know you want to get into the treatments, and if you want to, you can forward along. But I want to really spend some time, and I want to explain to you what isn't plantar fasciitis, because many people come into the office and they're a little confused because they are thinking they have plantar fasciitis when it's really something else. So let's look at the first one. So what is not plantar fasciitis? Here's an example of a Haglund's deformity. A Haglund's deformity is a bump on the back of the heel, right here. It can be a large bump up here, or it could be even a spur on the back of the heel. That's not plantar fasciitis. That's treated a different way, kind of similar, but that is not strictly plantar fasciitis, and the treatments here may help, but it's not strict. Plantar fasciitis is down here. It's not in the back. Another thing in the back of the heel is the Achilles tendon. So the Achilles tendon can come down. It can get little micro tears as it inserts into the heel. And this as well can be painful for people. People may have Achilles tendonitis at the same time as they have plantar fasciitis. Many times they can go hand in hand. The treatment for Achilles tendonitis is not exactly the same as plantar fasciitis. If you want to learn more about that, you can look at one of the other videos here. Also, what else is not plantar fasciitis is an accessory bone in the back of the talus called an ostrigonum. Sometimes there is a tendon that comes down called the flexor hallucis longus, comes down. It can irritate this area in the back of the talus, which can present as heel pain, as well pain on the outside of the foot with an accessory bone can present as heel pain as well. So people, no matter where you have the pain, you have to probably should see a doctor to determine, well, is it the typical plantar fasciitis or is it one of these other kind of variants? If you're a child and you have pain in the back of the heel, sometimes that can be a calcaneal apophysitis, which is kind of like a kid's heel pain. Very rarely do you see little kids with plantar fasciitis. Usually it's due to the growth plate. Occasionally you can see a stress fracture maybe back in the heel. But most likely for kids, it's going to be the growth plate. And then for adults, if there's a fall, there's a jump, there could be a stress fracture. One thing that can kind of cause a stress fracture would be a bone, kind of a bone tumor. So some type of a tumor. I'm not talking cancerous. It may not be cancerous. It could just be a fluid-filled sac or a blood-filled sac in the bone. And this may weaken the bone, causing a fracture or having someone to feel plantar fasciitis. Another thing that's not plantar fasciitis is the posterior tibial tendonitis. This is the posterior tibial tendon that comes down inserts into the navicular tuberosity and has a few fibers that go underneath. If you have a very flat foot, you see how the normal foot's aligned straight. Here's a foot that kind of leans inward, and we call it the too many toe sign, where you see the toes over there. That puts additional strain on the posterior tibial tendon, and you may have some heel pain as well, and you may think it's plantar fasciitis, but many times it's not. Once again, it can be in conjunction. Then going on to some of the nerve issues, there are some nerves that come down. The calcaneal branches of the posterior tibial nerve, that's one, and also the abductor digiti minimi nerve over here you can see coming in on the outside. I don't mean to confuse you, but I just want you to know that there are many other things that aren't strict plantar fasciitis and may not respond well to treatment unless it's diagnosed by a doctor. So let's go and talk about the treatment process for plantar fasciitis. I like to keep it simple. So if you have the traditional plantar fasciitis, pain in the bottom of the heel, pain when you get up in the morning, and your first steps are painful, when you sit down and get up again and it's painful, and it gets a little bit better as you walk and stretch. This is the treatment process I use. Very simple, reducing inflammation, reducing tightness, and stabilizing the heel. So let's go over this. Reducing inflammation, most people before they come and see us in the office, they try icing the area. You can use a bottle of water that's frozen, roll that. You can also try a cup with water and roll and rub that on the bottom of the heel. You can also do a massage in conjunction with this. That tends to help. People also try some type of anti-inflammatory medications such as Motrin or ibuprofen. There are some new ones that are special compounded topicals that you can put on there. Those things can help to reduce a little bit of the inflammation. Resting as well, keeping your feet up, can rest and reduce the inflammation. Staying in a walking boot occasionally can help. It can rest the area. I tend not to do that. I like to keep people more active when I see them in the office for heel pain. And then by the time someone comes and sees me, the way I treat it initially is with a cortisone injection to reduce the inflammation. This is a kind of a special concoction that we have, and that reduces the inflammation on the bottom of the heel. You put it right in front of where the heel bone is, right into the area of the plantar fascia. That reduces the inflammation, but you also have to do other things to help reduce the tightness in the back of the calf and so forth. But cortisone injection is really, really helpful. If you're scared of the injection, you really shouldn't be, because it really helps a lot. And people kind of leave feeling really good. And you're not going to need an injection every single time you come. We only do around 3 per year. Sometimes we can do more if needed. Now that's kind of the traditional approach. For some people, they like kind of the more advanced things, what the athletes get. So there's a treatment where you collect the blood, separate the plasma and the platelets, and you take them out and you inject that into the area of the plantar fascia. It's called platelet-rich plasma. That's also something that can be injected down there. Works very well. And not that the big of a recovery afterwards. Usually not covered by insurance at this point. They consider it experimental, but it is something that it's in the office if you need it. Another high-tech type of treatment I don't have here right now, it's going to be the shockwave therapy. I think we're going to be talking about that a little bit later, shockwave. So let's go on now to talk about how we reduce the tightness. So reducing the inflammation, you come in, get a cortisone injection, do some type of shockwave or some type of PRP. You still need to reduce the tightness in the back of the calf. So the back of the calf is the big culprit. I like to do deep tissue massage to the back of the calf. That's going to reduce it. And many times, if you just do a foam roller or some type of a trigger point ball, these are the tools that we use. They work really well to work in the back of the calf and loosen up the area. It's very, very helpful, and it reduces a lot of the tightness back here, and it also reduces the foot pain. Many times, just by working the back of the calf, you can make the heel pain go away, at least a major part of it. For those that want to do physical therapy, there are a lot of other modalities that they use and treatments and functional movement screens and such. What we find most helpful is the Graston technique. That's taking a hard piece of metal and rubbing it down the back of the calf. Works great for loosening up the tight muscles. It also helps the heel. Once again, you realize in the calf, we're not working the heel, but we're working all the muscles that go down there. If they're tight, if they're bound down, it's not going to work. Kind of a lazy man's way of treating it is with a night splint. This can be worn at night. It has the one in the back. There's also a front one. You can buy one. Sometimes it helps if you're strictly have that morning pain, and it can help by like strengthening or loosening this area. This is called a Dynasplint. This is a dynamic way of doing that. I still find that the foam rolling type of treatment works better. With this deep tissue massage, works better. Some people do stretching. Very rarely do we recommend stretching unless you can't do anything else. If you can't afford any of the other tools, stretching can be helpful. Physical therapy works on that usually, but deep tissue massage is so much better. Let's go on to correcting the heel alignment. Usually we use a supportive shoe that's able to help stabilize the heel, and then we go on to orthotics, different severities of orthotics to give more support. The whole goal of an orthotic is to help straighten the heel position. You can see the heel is going outward here, and you want to bring it from bringing out to bring it back in. That's going to help stabilize the heel, and it's going to make the tendons all work better. And it's not going to directly make the heel feel better, but it's going to help realign everything so it can heal on its own. A few other things you may try. One's called a plantar fascial support. This is helpful to help reduce the pain. It has a little air cushion down here, and it shoots back and forth. And this is helpful temporarily. It's not to be used long term. Also, some people feel good with compression stockings or a compression sleeve. That's going to be helpful. And one of the more advanced therapies that we talked about is called the shockwave therapy. This uses sound waves, and it actually helps to reduce the inflammation down here by causing trauma or injury to the area, and that brings more blood flow, very similar to the PRP, bringing blood flow and helping healing. So it causes a little micro trauma to the area, brings more blood flow, and helps to heal the plantar fascia. For those that don't respond to these treatments, there is some surgical treatment that can be used. Topaz, which makes little holes. Once again, the holes allow you to bring more blood flow and help that to heal. And then kind of the last resort is with plantar fasciotomy, which is a way that you can cut through the plantar fascia to help heal that. So those are all the treatments. Most people watching this aren't interested in surgery. They're going to want to see a doctor. And if you have problems or concerns, or you want to learn more, I did put a few more resources on our website, centralmasspodiatry.com/heal. What you'll see here is actual videos that explain how to do the deep tissue massage, other resources as they're updated, because this is kind of a dynamic subject and there's always new items for you. So I hope you found this helpful. If you want to learn more, go there. Thank you.